please use our Twitter handle, which is PHIRI4EU. If you want to share any thoughts or any experiences during the course, don't hesitate to use Twitter. And we're here to support you. So if you have any questions, if you have any problems, you can put them in the chat, or you can send us an email to phiri.coordination@sciensano.be. So you may wonder, why Infodemic? Why do you want to organize a workshop about Infodemic? Well, some of you are already very familiar with the term, some of you are not, and we will have the pleasure of having Christine from the WHO explain to us what Infodemic is. But I wanted to start with this because it's really something that has changed over the past years, of the importance of sharing information and the way we handle information that is shared in various ways across the globe. So as the Director General of the WHO stated, we're not just fighting an epidemic, but we're also fighting an infodemic. And so even just a few days ago, 2 days ago, the WHO also tweeted, it's really important to train professionals in infodemic managers, because we need to better understand how to develop clear risk communication message, how to understand infodemics, and how to deal with it. So we're very pleased with PHIRI that we can also organize this workshop to really help the capacity across Europe to deal better with infodemic, and to bring across some of these experiences that countries had across Europe, but also globally, with infodemic management. So what is the purpose? What is the aim of the workshop? Well, we want to gather European experiences, lessons learned, and good practices in infodemic management during the COVID-19 pandemic. So it will have a bit of a COVID-19 pandemic focus. And we also want to provide tips and practical tools. There will also be an exercise on how to do infodemic management. How will we organize? Well, we will have 2 sessions. The first session is today, and it runs from 9:30 to 11:30. And we will have another session next week at the same time from 9:30 to 1:30. Both meetings are online through WebEx, but there's a different link for each day. So I just popped the link in there for tomorrow. And all the materials are available, or will be made available, through our website, which is phiri.eu/infodemic workshop. So what we really wanted to look at is what worked well during the COVID-19 pandemic in terms of infodemic management. What was difficult? What profiles were involved in infodemic management or should have been more involved? What tools were useful? What could be done to be better prepared for the next crisis? So we really hope that during these 2 sessions, we will be able to respond to many of these questions. So today we have a very full agenda, and we're very pleased to have Christine start off from the WHO, who has also been leading the Infodemic WHO management training course. And also along that, we have Tina Pernat, who is currently based at ECDC, who is also who has actually launched the first batch of infodemic trainings that the WHO has organized. Then we have a lot of other very interesting speakers lined up for you. The first session will be with Rebecca Winkles on, she's from Wissenschaft im Dialog, which is Science in Dialogue, Germany. And she will be talking about COVID and science communication reaching out to the undecided. And then we will have Giovanni Zacni from Pagella Politica in Italy, which is a website on infodemic communication. Then at 10:50, we'll have a break. And at 11, we will start again. And this second session focus a bit more on some experiences from countries themselves. So we will have Leonardo from the Institut Pasteur in France on opportunities and challenges of blending online and offline social listening of infodemics. Then we'll have Stefan from the Faculty of Medicine in the University of Belgrade from Serbia, talking about ups and downs on infodemic management in Serbia. And we will finish that session with Vitalba, who will be who's from the European Science Media Hub, and we'll talk about knowledge-based science communication to tackle the infodemic. Then we will have a Q&A session, which is a bit more extensive, where all different kind of questions can come up and a bit of discussion will be moderated by Tina. So you will have an opportunity to ask short questions after each of the presentations, but we will have a dedicated session for a more in-depth Q&A and discussion. We will break up for lunch at 12:15, but just before that, we actually have prepared for you a board, a Miro board, in which you will be able to share memes, and there will be a memes generator, which my colleague Ninko will explain to you. So it will be a great gallery of infodemic memes that we will collect throughout the 3 sessions that we're organizing today and next week. Then we will have a presentation from Laura about the EpiTweeter tool, and we will finish today at 1:20 with concluding remarks, and you will all receive a goodie bag also with interesting material and follow up for the next session. But before we start, I will give a very short introduction on PHIRI, what PHIRI is. So PHIRI stands for the Population Health Information Research Infrastructure for COVID-19. So we're a project that started in November 2020 and will be running for 3 years. We have 41 partners in 30 countries, mostly National Institutes of Public Health, Research and Disease Control Centers, but also universities and ministries of health. Basically, a lot of people that have been at the forefront and are at the forefront of the COVID-19 pandemic. And so we're a European mechanism, and what we really aim to do is to facilitate and support research, data-driven population health research across Europe. But what we also work on is the exchange of best practices to support decision-making, and of course, capacity building, which is one of the activities we're having today. So what do we look at with PHIRI? We're not only looking at the direct impact of COVID-19, but we're also looking at the indirect impact of COVID-19. And we are setting up a research infrastructure which allows to share data across countries, and which allows to share expertise across countries. So I will focus a little bit today on the activities that are specifically relevant for Infodemic. Of course, we have a variety of activities, but here I will focus just on the ones that are relevant for Infodemic. The first one is the Health Information Portal. So we have just launched a European Health Information Portal, which brings together catalogs and descriptions of different types of data you can find across Europe. So this includes both national sources, national data sources that are routinely collected by countries, but it also includes international data sources you can find on population health information. So as I said, information on national nodes, which are our national contact points and research networks, which operate across countries in a dedicated theme. Health information projects. So we also have an overview of all different types of health information projects you can find across Europe. And we also have information on how you can get access to these different types of data sources, who are the data providers or the data managers in each of the countries. So don't hesitate to have a look at that website. And then another activity which is relevant for infodemic management is we have a rapid exchange forum, which we organize 2 times once every 2 weeks. And what the purpose of that forum is to be able to respond to quick questions that policymakers or researchers have across Europe, and to exchange between countries. So a lot of the questions can vary. Some of the questions that we have been addressing is, for example, how are countries planning to accept recovery certificates? How do countries organize the treatment and management of long COVID? Or how is the verification ongoing of green certificates, and many more. So we've had 14 meetings so far, and usually we have quite a good amount of participants and distributions across countries. So if this is something you're interested in, don't hesitate to contact us. So that's it about PHIRI. Now we want to hear a little bit from you. We have a Mentimeter that we will be sharing with you, and you can use the code which is mentioned here to put it into menti.com, or you can just simply use your phone, scan while you're looking at the QR code, and I give the floor to Tina, who will be helping us and introducing us and moderating a bit this icebreaker. So Tina is here today on her personal behalf, but she's working at the ECDC. And we've had the pleasure of working with her before. And as I said, she has been organizing and leading the first infodemic management training that was organized by the WHO. So Tina, thank you so much for being here, and the floor is yours.
Thank you, Pétronille. I really think health information systems and professionals are literally putting public health on the map and serving Europe currently. So it's really great to be able to work with your team and the PHIRI project. We prepared just two questions just to get to know each other. There's 46 people on the call. Where are we from? From Germany, Hungary. That's a good spread, actually, for 46 people. Look at that. I think it shows the interest across all of the different countries. And I think the PHIRI project is probably biasing the Belgian response a little bit. Great. Oh, look at this, UAE even. Amazing. There's some international connections being made today. Great. I look forward to the discussions. What about the second one? So the second question, where do you work at? So we just wanted to see what is the spread of the different types of settings that you work in. Right. So we have quite a lot of people that work in health authorities. We have some academics, European institutions, civil society, a student, and other even. So great. I actually think this is going to be a nice conversation because especially those of you that are in the minority, please speak up. It's always important to get a lot of the different perspectives in the infodemic, the discussions of infodemic management. Cool. Pétronille, what do you think? Is this what you would expect for a PHIRI event?
I think yes. I mean, we've really been trying also to reach out a bit further than our usual partners, but I do see there is some other people joining as well. So I'm happy. I think it's a good distribution, and also, of course, we've targeted our audience to be coming from Public Health Institute and Ministries of Health.
Perfect.
So in that sense, I think what we have lined up for you today fits in really nicely.
Perfect. I look forward to the discussion.